What's my proudest moment? Well, I think I've had, first of all, in all my work experiences and volunteer experiences, I've always looked for ways to connect Armenia into my work. It's always been part of my brain. My grandfather, who was so proud to be Armenian, he was also so proud to be an American citizen as well. But his Armenian, the proudness that he carried, the pride in which he carried himself in being Armenian, is something that he passed on to all of his grandkids, including myself. This was in the summer of 2019, before the world would shut down. Some friends came to me and they were organizing a trip to climb up Mount Ararat. And I, first of all, didn't even think it would be possible to do. I didn't know that people were going up the mountain, or this was an annual tradition that some groups were doing. And then I went into some self-doubt, thinking, is this something that I could physically do? Do I have the physical capacity or the mental capacity to take this on? And I realized that actually none of that really mattered. And I was so consumed by the opportunity to connect so deeply with our homeland and our roots that it sort of overcame all of the weaknesses that I had related to my physical abilities to climb. I'm not a mountain climber, but we got it done. The scenery all around. Oh my God. It was such a fulfilling experience, almost a culmination of so many years of pride and learnings that we have as Armenians, Armenian-Americans in particular, about our culture. Doing that is something that I talk about almost on a weekly basis. And I still have with me some of the rocks that I carried back down and other memorabilia as well. What's that? So I moved here after grad school. I went to Boston for grad school, and it's been 13 years now. I've had a couple jobs since I moved here, and it's just been, I consider it home now because it's been so long. And DC is one of those cities where it's diverse and it's changing, and a lot has changed since I moved here 13 years ago. But it's fun, and it's small enough where if you walk down the street, you see your neighbor or you see colleagues you work with walking their own dogs. So yeah, I was born and raised in Los Angeles, like many Armenians, and I went to. My parents worked hard to send me to an Armenian school, a private Armenian school. I went to Ferayan, and I am grateful that they had multiple jobs at some points in our lives to be able to pay for that education that I received. Usually in your high school years, you go to Armenia, and we didn't get that opportunity to go to Armenia. But so South Africa became the first international experience for me, and it really shaped the way I think about the world. And at the time, this was around 2003, at the time South Africa was dealing with the brunt of the HIV epidemic. It was killing people, thousands of people on a daily basis at that time. And there are stories and stories of funeral parlors running out of coffins to put people in. And around that same time is when you saw the proliferation of medications in the United States for HIV, but that was not available in South Africa and in the developing world more broadly. It was the United States through this PEPFAR program, the program that I work for now, that brought those life-saving medications to Africa and across the world. But I saw those inequalities firsthand as a fresh out of college. These are things they don't teach you in the classroom, but for me it shaped the way I think about the way I consume things myself when I returned. I remember just in terms of the clothes in my closet or the food on the table, I was constantly referring back to my experience in South Africa early on. I was always doing things to go into medical school. I did lab research, volunteered at hospitals, volunteered at clinics, and it was that experience in South Africa where I was exposed to the real public health issues that are driving inequalities, where I decided that a public health career was one for me. And I'm very lucky that I've had jobs that allow me to fulfill my passions for fighting inequality, developing access to health for all patients and all people around the world. I decided that Washington was calling me, so to speak. I was exposed to policy issues. Was fascinated by Congress and how Congress decides on bills and who writes the bills and why do bills pass and some don't. And since then I've stayed here. I've had jobs elsewhere in the private sector, and about 5 months ago I joined the State Department. So around the time of the election, the most recent election, which of course many of us remember so well, we were also politically involved in the election, no matter what side of the aisle you're on. I saw this election as a really important one for our future, for the future of human rights, for the future of the United States standing in the world, for the way we take care of our own citizens, whether it's healthcare access, environmental justice, all of these other inequalities that we were facing, voting rights, etc. And with all the work that the State Department is doing around COVID response and health in general, this was a natural landing space for me, and I started about 5 months ago. HIV has been around for 40 years now, and we've learned a lot about the disease. There's been a tremendous amount of progress in science as it relates to the development of antiviral medications, and as well as prevention modalities to help protect people from getting HIV in the first place. There's been a lot of progress, but there's still a lot of stigma and discrimination. And even in countries like ours here in the United States, where we have put a lot of people on treatment, access still remains a challenge in communities of color, in parts of the country, including in the South, where Medicare expansion and other healthcare services remain limited. And we've seen progress globally as well, but HIV still remains one of those issues where people, there's misinformation about how the disease is spread, misinformation about how you can protect yourself. And the truth is, we have the tools to protect ourselves now from getting HIV. There are PrEP options. They're called PrEP, pre-exposure prophylaxis, to help prevent HIV infection. And those who are living with HIV, when they're on medication, their virus is completely suppressed in the body, and so they live normal and healthy lives. And I think most people still don't recognize the power of science as it relates to fighting this disease, and to recognizing those living with HIV as full humans and who deserve the rights and protection that all of us do. And those challenges exist here in the U.S. and they exist in Armenia. They exist all around the world. And so the work is unfinished. COVID-19 is interesting because those of us who've been working on HIV for a long time, we see a lot of similarities as it relates to the way COVID is spreading in communities where access to healthcare is limited, where stigma and misinformation continue to fuel people's inability to access treatment or COVID testing. And so there are a lot of similarities with how COVID is now spreading and how HIV started in the early days. When I think about what I want to do on this planet, or how I want to live my life, I think of a quote from Archbishop Desmond Tutu from South Africa. He actually just passed away a few days ago, and I'm going to paraphrase a quote that he used to say, which was, "If every bit of us does a little bit of good, that little bit of good goes a long way in changing the world. It's a very simple phrase, and I may not have it exactly right, but for me the point is we're all here, and we have a responsibility to do a little bit of good in this world, whether it's for your next door neighbor, or it's for community that you serve through your job, or if you're serving, if you're working on Armenian issues to work on the homeland, or whatever it is. We all have to do something, I think. And for me, my dream is to continue to have opportunities that allow me to fulfill some of that good doing.
So what is there about the photo of your mom?
My mom is someone who has worked so hard her entire life, whether it was working multiple jobs to put me through school, or to put food on our table, and I'm just always inspired by her convictions, her passions for also bringing people together. When I was growing up, we would often bring our neighbors together in our homes, and I love that. And she's such a strong and independent woman that she really is an inspirational figure for me. And she always wanted to go to Paris. And one day I had a work trip, and the first thing I did was buy her a ticket as well. And I had never seen her smile and be so happy in that moment. And I was just so honored that I could share that experience with her.